You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, bioidentical hormone replacement therapy for women. My first guest is an expert on the topic. He's San Diego's go-to hormone replacement therapy doctor in San Diego, Dr. James Fontaine. Dr. Fontaine, welcome to the program.
Thank you for having me, Randy.
So this is a big topic. I have lots of questions, but first, your practice. Like, who's the typical woman that's coming in for bioidentical hormone replacement?
Well, let's break it down a little bit, a couple different age groups. The first group might be that late 30s, early 40s group, and the perimenopausal group. They may not even know they're perimenopausal, but they're starting to have irregular periods. They're gaining weight for unexplained reasons, especially abdominal weight. They may have problems sleeping, which really actually is a very common symptom that brings women into my office.
Okay.
Not sleeping is really, it's just life disruptive. You want to be able to sleep. They may have little mood changes, irritability, fatigue, things like that.
You say their PMS becomes worse.
PMS
sometimes.
definitely worsens. The women's body loves consistent hormone levels. When the hormone levels start getting erratic, as they do in the perimenopausal age, that's when the symptoms become most prevalent. So that's the perimenopausal group. And then we have the menopausal group. So menopause is defined traditionally as no menstrual cycle for a year, or you could actually define it with laboratory value of FSH greater than 50. So that group of symptoms, or that group of women, tend to have the very similar symptoms in that they have fatigue, weight gain, cognitive issues, poor sleep, the dreaded hot flashes and night sweats, which are really, really disruptive. I mean, some women they're soaking their bed to the point that they can't
Really?
sleep. It's horrible. I mean, the stories I hear, makes me feel really bad for these women. And fortunately, this stuff's treatable. And then, the memory is a big issue. They often label this brain fog. So what's brain fog? Brain fog is just when you're just not as sharp as you used to be. You start having difficulty finishing sentences. A little more frequently, you go in the room and think, what was I going to do? And some people call it that kind of a loss of competitive edge. That's what I hear from the women that are in the workforce. They just kind of feel like they're not, keeping up with these younger people coming in. It's harder to learn new things, whether it's a computer program or whether it's the new strategy, the new corporate strategy, any of these sort of things that you're just not as sharp.
So it helps your brain.
Yes, hormones can help your brains, both testosterone, estrogen, and thyroid. All three of those are significantly impactful on brain health. So
you see reversals? I mean, you see women that come to you one way, maybe feeling lousy, can't sleep very well, and then because I know this is a topic, we're talking about bioidentical hormones, and you have a big focus on nutrition, but you clean up the nutrition, give them, or optimize their hormones, or bring them up to what, more youthful levels? Like, what are you doing?
The best word you said there, Randy, is optimize. Okay, so what we're trying to do is optimize hormones. We don't just use lab values. I mean, lab values are important. We don't want to be too high or too low, but lab values cover a wide range of what's, quote, normal, right?
Okay.
One of the instructors that I trained under, Dr. Rouzier, who's a world expert in hormones, he says, normal lab values are for lab values taken on old sick people in the hospital. Well, that's not what you want to be. So we want to optimize lab values. In other words, we want to get your hormone levels to a more youthful level. Okay? When hormones are at their highest is when you're the healthiest. You think about it, hormones are highest when you're youthful. Well, you have less cancer, heart disease, stroke, osteoporosis. You don't have those when you're in your 20s, typically, right? That tends to be disease of 40s, 50s, 60s. Well, that's when the hormones are really declining the fastest as well. So you want to keep the hormone levels optimal. For example, if you went to the eye doctor and you said, give me a prescription for eyeglasses. I'm 50. I can't quite see as well, far, and I have to, my arms are not long enough. Can't read my book, right?
Yeah.
We all know about that. So you don't say, give me a prescription so I could read like a 50-year-old. You want 20/20, perfect vision. You want to be able to see close, see far. Okay. Well, that's what we're trying to do with hormones. Trying to optimize the levels so that you're more youthful. You're more at the level when you were at your peak in life.
So you take a woman in her 50s, you bring her hormone levels up to maybe somebody in their 30s, and they feel and act like they're younger, in a way?
They do. I have patients that come in, they say, fatigued, tired, overweight, irritable, hot flashes, night sweats. Okay, and you take a patient let me give you an example. So I had a 48-year-old office administrator, pretty healthy person, really no systemic illnesses, runner, active person, and wasn't quite feeling on her game, you could say, right? And this is an athlete, so athletes, they kind of know, they're tuned to their body, right? Wasn't quite on her game, was having night sweats, hot flashes, a little bit of that brain fog, and also the sleep. I mean, the sleep these women go crazy when they can't sleep. So I get her on the hormones, testosterone, thyroid, progesterone, estrogen, the kind of the prime four that most of these women are often candidates for.
Okay.
Within about 3 months, she's feeling better. She's lost some weight. She has more energy to exercise. The brain fog is gone. Night sweat's completely gone. Okay, she's sleeping again, and the libido went back up too. So you take all that, and she's telling me the story, and I'm like, well, that sounds pretty good. She says, it's better than I thought. So I said, what do you mean by that, right? It's better than you thought. She says, well, what it is that she considered herself a strong person. She goes, as a strong person, I look back and I was surviving. I just thought that's what I was supposed to do. Women go through this stuff. Grandma had it, mom had it, my friends have it. Now, 3 months later, she goes, I'm living again. I got my life back. I got my energy back. I've got my drive. My job's better. My relationship with my husband's better. My athletic abilities are better. That's a change in symptoms right there.
So that's common, that kind of a thing in your practice? A women feeling like that? A
yes,
reversal?
That's what we expect. That's what we expect out of our patients. If the patient goes along with our program includes hormone optimization, and there's some lifestyle stuff in there too. You still have to exercise, you still have to eat clean. Really not complicated eating. It's not calorie counting, but it's just eating clean, anti-inflammatory diet. If you do that, you can start thriving again. That's what we're shooting.
I like what you said on the phone, that your program allows women over 40 to do more of what they love to do in life, whether it's hiking, getting back to the gym, being motivated, starting a new business. So the hormones just give you your energy back. Is that kind of part of it?
That's a big part of it. I mean, okay, if you're not sleeping, how are you going to feel well, right? And I would say sleeping is one of the most, or lack of sleep. Let me say lack of sleep is probably the most common things I hear about in perimenopausal and menopausal women. Okay, so if we can fix their sleep, we can fix a lot of other things.
That alone, they're going to feel better the next day.
Yes, and the other thing is irritability. Okay, I mean, I just said that women don't do as well with variable levels of hormone, right? I mean, when you have PMS, for example, it's because there's a sharp decline in progesterone in the second half of a female cycle. So if the hormones are all out of whack, and 1 month they're high, 1 month they're low because the ovary is sort of withering away and just not producing what it used to, well, that's the perimenopausal symptoms. If you're menopausal and you're just not simply producing estrogen and progesterone anymore, then you're going to have all the same symptoms on a more permanent basis. So we need to get these hormones back to a level where you're sleeping again, you're not irritable, you're not moody. There's a category that they talk about when you talk about thyroid and testosterone. They both have an improved sense of well-being. And what does that mean? I mean, a medical term, until I started studying hormones, I didn't really know what that meant. No one really talked about that before. Sense of well-being. It's obvious once you're on hormones. A sense of well-being. I mean, it's
like
hard,
optimism
it's hard,
and just feeling good?
You just feel better. You have your energy. You have your drive. Okay? Imagine being a 50-year-old woman. You have vaginal dryness. You have painful intercourse because of the vaginal dryness or your general atrophy from the decreased estrogen. You're gaining a little bit of weight. You're not sleeping. You're irritable. Okay? Well, of course you're not gonna have any libido, right? Plus your libido's in the tank because your hormone levels are down, right? So if just restoring someone's sex life, right? I mean, that's a big part of life. I mean, think about when you're in your 20s and whatnot. I mean, that was a goal. That's all you're thinking about. Well, obviously, as you get older, things change, but that doesn't mean that you can't enjoy an important, gift that human beings have, the ability to enjoy each other.
Is this the new aging gracefully?
I think so.
We've talked off camera, but I mean, Hollywood has adopted this. I mean, if somebody's over 40, over 50, and they look good, chances are they're doing hormones.
Oh yeah, they're not just getting Botox. They're getting their hormones. They have dietitians that help them eat optimally. They have people helping them exercise, and it's not just a one thing fix all. I mean, hormones. It's an integral part of aging gracefully, aging
And
healthfully.
insurance doesn't cover what you're doing, but it's really low price. We were talking in the green room, probably a lot less than like a Jenny Craig or Nutrisystem, like these weight loss programs.
Yes.
I mean, your program is affordable.
It
for
is
most
affordable.
people.
It's affordable, and it's, you know, it's hard to put an exact cost on preventive medicine, but we're actually preventing disease. One of the things I tell my patients, I'm going to treat your symptoms, but I'm also going to treat the things that you don't even know is going on. Like,
Okay.
what does that mean, right?
Yeah.
What I mean by that is testosterone, thyroid, estrogen replacement, they all have a significant protective benefit against weight gain, especially abdominal weight gain, which then leads to insulin resistance and diabetes. Okay, testosterone, estrogen, progesterone, very important in bone health. Okay, so you're going to reduce the risk of osteoporosis, which is hip fractures, wrist fractures, and elderly, very expensive and debilitating illness. We got brain health. Again, the same hormones, especially testosterone, estrogen, and thyroid. They all prevent significant risk reduction, anyways, of Alzheimer's and other dementia, cardiovascular disease, etc. I mean, women don't realize this. I think they all think about breast cancer, right? Everybody fears breast cancer.
Yeah.
I fear breast cancer for my wife. I mean, no one wants to have breast cancer. But the leading killer of women is cardiovascular disease. 1/3 of postmenopausal women deaths are due to cardiovascular disease, and 1 out of 7 premenopausal. So it's not just breast cancer.
So testosterone, these things are good for the heart as
They
well.
are good for the heart, yes.
Okay. Now, let's go hormone by hormone for a minute. So let's start with testosterone for women. And for people just tuning in, we're talking about bioidentical hormone replacement therapy for women. And we picked the women over 40 starting to get symptoms of like irregular periods, mood changes, lack of libido, concentration problems.
Right.
So testosterone. When you think of women and testosterone, do they even really have testosterone levels? And how do they know if they're low?
Well, I love talking to women about testosterone because, like you said, or inferred anyways, I don't think a lot of women think they have testosterone. So they kind of have the shocked look on their face. What do you mean testosterone? You know, am I going to be a man? And I said, no, we're not going to turn you into a man. You don't have to worry about that because actually women's testosterone peaks in their late teen to mid 20s. Well, when do women feel they're sexiest, right? When do they have the best physique typically? They have the best skin, you know, they have the best skin tone. They got that glow, they got the best hair. Well, that's when their testosterone is the highest. So that's when they're what I'd call them the least manliest, right? I mean, that's when they're the prettiest. So
Good point. Okay.
And usually the most athletic
so late
too.
20s, in their 20s, they're at a high level of testosterone.
Yeah, so by the time I see them in their late 40s, they have 20 years of testosterone deficiency. And testosterone actually plays a key role in night sweats, and not just estrogen. Estrogen is the hot flashes, right? But a lot of the other hot symptoms like night sweats, just soaking that shit out, that's actually testosterone. We put the women back on testosterone, those symptoms reduce pretty quickly. And then testosterone also has to do with things that, again, they don't realize, brain health, bones, protection against breast cancer, heart health. So I have this one patient who's, let's see, she's about 52, okay? Her chief complaint at the time she saw me was night sweats. They're horrendous. She could not sleep, okay? Well, that's not really the best for your marriage when you're not, you know, sleeping and you're sweating and, you know, you're getting up all night. Her libido was in the tank because she didn't feel good. She was a sweaty mess, for lack of a better word. She was not, you know, feeling attractive. She had a busy job, so the poor sleep was affecting that. She had to commute to the city. Got her on a combination of thyroid, testosterone, estrogen, and progesterone. She was menopausal. She had basically no estrogen, no progesterone. Within a few months, she basically had elimination of the night sweats. So that was really what she was happiest about. But she said, oh, I like to run. When I go on a run, I feel like I have more energy. Okay, so she's getting more energy. And then she started getting improved libido, you know, and of course, you know, that's good. I mean, that's an important part of life.
Yeah.
Turns out her husband was a hormone patient as well, so sort of their libido was then in sync, if you will, and that.
So is that common?
Helped.
So the woman goes to you for hormone replacement. They're starting to feel good, and then they drag their husband in to get hormones as well? Because you do men and women.
I do both men and women. I'd say it's more common for the women to drag their husband in, but when the men are on hormones, okay, one of the chief complaints for men is also the cognitive issue, the decreased ability to work out and feel good after workout, but also the decreased libido. Okay, so we get that all in check with the testosterone, and then you don't want to be the only one in the household with libido, right? I mean, that
Okay.
doesn't work too well. So they may send in their wives for those reasons. It's a little harder to send your wife in to say, oh, you're irritable. Right?
Yeah.
I mean, if you say I want to help improve your libido, improve our sex life together, then that's positive, right? Telling someone they're irritable is not positive. So it turns out, though, however, they start finding out when they read our questionnaire and everything. Oh, wow, I do have a sleep problem. I do have, fatigue. I do have brain fog, and I do have all these other issues. So so it's not hard to get the women in once they think about how they're really feeling.
So this, this word biohacking is a new buzzword. So this is in a way a cheat, like you're cheating Mother Nature in a way, where, I guess you age and hormone levels go down and you're just kind of replenishing those hormones that go down with age.
I guess
Is that kind of...
I guess cheating. I never really thought it was cheating, but I think that's a great analogy.
Like if somebody like you, I know your age. I'm not going to bring it up on the show, but you look at least 10 years younger.
Thank you.
And I asked you in the green room, are you on hormones? You said you're on hormones. So you're kind of cheating the system. You take hormones, you look good.
Well,
you have energy.
I suppose cheating the system is one way to put it, but optimizing my opportunity.
Good. Okay.
That's more the way I look at it. So, for example, when I turned about 50, I started losing my edge a little bit. I was getting a little irritable. I started getting a little abdominal weight gain. Just a little less drive to go out and ride my mountain bike. I mean, that's kind of like my main sport, right? I just lose, unless I had a commitment with one of my buddies to go. It's like, I don't know, I got to do that today, right? So I started testosterone, thyroid, DHEA, pregnenolone. Within a fairly short time, the first thing I noticed, I started sleeping like a baby. I was sleeping like a teenager again. I mean, I wasn't oversleeping like a teenager, right? I was able to get him to go to work, but I felt good. I started having the desire to work out again, which was optimal. I cleaned up my diet, and I think that had a big part of it too. So within about 4 months, I did a repeat body analysis. I lost 8% body fat, so I went from an unhealthy 26% to 18%. I lost 11 pounds overall weight, which to me wasn't quite enough, right? I thought I should lose more weight than that. And then I realized with the body analysis, I actually lost 18 pounds of fat and gained 7 pounds of muscle. So there was a net 11-pound weight loss. Well, that made me feel a lot better. And that was just the beginning.
Good. Thyroid. Moving on to thyroid. What's it responsible for in the body, and how do you know if you're low?
Well, thyroid is one of the most important hormones because, basically every cell in the body has a thyroid receptor. Thyroid is important for metabolism. It's definitely one of the feel-good hormones. So low thyroid, you're just not feeling well. The most common, 4 that we tend to rattle off with thyroid deficiency is you're weak, cold, tired, and fatigued. That's common. How many times you're sitting in the movie theater, your hands are cold, your feet are cold, and the person next to you is nice and warm. That's not normal. You think it's normal, it's not normal. Thyroid is also one of the big brain fog hormones. So, low thyroid start to feel that brain fog. Also weight gain. Weight gain in the middle. Weight gain in the middle is bad. That causes insulin resistance, causes diabetes. So we want to work on weight gain.
Okay. Now, some people will go to their doctor. We've had this discussion. I want you to clear this up a little bit. But they say my thyroid was checked and I was fine. I was in the mid-range. You say the mid-range may not be where you want to be. Can you elaborate on that? And I'm paraphrasing you slightly.
Yeah, the mid-range is where you want to be is optimal. Okay, so the normal values, lab values, they encompass a wide range. Okay, and that includes people who are not doing well and are doing well, but they're within quote normal. Okay, well, let me take my wife for example. My wife had all the symptoms of thyroid for years. She had cold hands and feet, thinning hair. She was concerned about her skin, fatigue. The only thing she didn't really have is the weight gain.
Okay.
And a lot of people think, oh, if you have thyroid issues, you must be overweight. That's not true. You do not have to be overweight to have a low thyroid. She went to her doctor at least 4 different times, and they checked her TSH. TSH is just the common screening test, but TSH is just a hormone, thyroid stimulant hormone, that tells your thyroid to make more T4, which then gets converted to T3. It's actually T3, which is what works on the cellular level.
So she was told she was fine.
Over and over again, I kept saying, you need to check your thyroid. I did, it's fine, you need to check your thyroid. Well, when we checked her thyroid and actually did the full thyroid panel that we do with the T3, her T3 was in the low normal range. So when we got her thyroid up into the optimal, the 4 to 4.5 range, upper limit of normal, still normal, but the upper limit of normal, she started thriving again. I mean, she had, better memory. Matter of fact, she told me, she said, before I started this medication, I had a hard time remembering what I had for breakfast yesterday because I could tell you what both you and I had every meal for the last 2 weeks. I'm like, wow, that's pretty impressive.
Okay, that is.
And then she started being, exercising more. Her skin felt better. She had less hair loss, and so it was a positive impact on her life.
Okay, progesterone, and we're short on time, but you say it's like the feel-good hormone for women.
Progesterone is definitely one of those hormones. Kind of goes along with estrogen. They tend to decline at the same time, other than in the normal menstrual cycle. But in the perimenopausal age, the progesterone goes down, and it does affect mood, irritability, and you also lose some of the benefits of the cardiovascular protection, bone health, heart health that you get when you optimize estrogen and progesterone. But the one thing about progesterone, the reason why I love prescribing progesterone, is it helps women sleep. There's hardly a woman who comes in to see me that sleeps well. Put them on progesterone, and it actually acts pretty quickly. Some of the hormones that take a little bit of time to kind of do the metabolic changes in your body,
all right.
But progesterone, in a matter of days to weeks, they're sleeping better, and that's a game changer right there.
Now, what about estrogen? I want to ask you about that.
Well, estrogen is a hormone that I think women are very familiar with, unlike testosterone, for example. So the common symptoms of low estrogen are hot flashes, irritability, poor sleep, loss of skin integrity, vaginal dryness, which leads to painful intercourse. So it's very common. It's symptoms I think that women are often familiar with. But what they're not necessarily familiar with is the fact that you don't have to just accept these symptoms as normal aging. Just because grandma did, just because mom did, it doesn't mean that it's okay. It's normal, but it's not okay. I mean, with proper estrogen management, all those symptoms can go away. And you also get protection against bones, helps prevent osteoporosis. You get protection against dementia, and you have a significant cardiovascular benefit to having optimal estrogen levels.
Now, we really are out of time, but take me through the process. So a woman, 40 plus, she's having symptoms that you've talked about. What's day one like?
It's pretty straightforward. You just call our office or you go onto our website and click the book an appointment button. We'll contact you. We have great staff, very, very nice. They'll talk to you about how the process works, which is pretty simple. You make an appointment and come and see me. We do a detailed questionnaire, a detailed history. I really need to get to know you. In order for me to help you optimally, I need to know quite a bit about you. And then we'll follow that up with labs. And the labs will be based on individual symptoms, physical examination, history. And then after that, we meet and we come up with a plan. We come up with a plan of how are we going to optimize your life? How are we going to allow you to age healthy, age graceful, and hopefully get rid of all your symptoms while also protecting you against the things that you didn't even know you were at risk for.
Okay, so, and then the anti-inflammatory diet. So you're big on nutrition.
Yes.
So they go together. Like all of your patients are going to also be given recommendations for eating and hormone optimization.
Yes, we discussed proper diet, basically the low inflammatory diet, a lot of plant-based products, and also exercise. I mean, they all it's really a three-pronged platform. I mean, you can't just take hormones and feel fabulous. You can just take hormones and feel better.
Okay.
But I want you to feel fabulous. I mean, I know probably every woman watching this show has said, "Oh, I know. Oh, my doctor tells me I have to exercise."
Everybody says exercise.
But you don't feel well enough to exercise. I mean, how are you going to exercise when you're not sleeping? Okay, you're fatigued, you're irritable, and when you do exercise, you gain weight. You're like, this is what the heck. So I'm telling you, what I like to do is I like to optimize this thing, and I want women to see results, and I think they can.
So
it does take
energy
effort
to go back in the gym.
Yes, they
or
do.
cycle or do whatever they do.
Yes, that's what it's about. I mean, what do you want to do in life to feel well? What you want to do is you want to do the things you love to do.
Okay.
And if you want to go out and ride mountain bikes or run or surf or whatever, you can't do that when you're not feeling well. You don't enjoy it if you do. So we want you to feel well. We want you to exercise. We want you to have the energy to exercise. And I think that, if you feel well, you don't really mind exercising. Also, I'd like to mention that we're doing stuff with PRP and stem cells to help you, stay active. We can treat shoulder pain, knee pain, hip pain. As my background as a physiatrist, I have, years of experience.
So you're injecting like shoulders and knees, people with pain as well.
Yes, and we're using these what we call orthobiologics, or they're natural products derived from you, concentrated to concentrate the stem cells, the platelet-rich plasma, and it promotes healing, decreases inflammation to get you back to playing tennis again, golfing, running. You know, I want my patient to be the healthy San Diegans that you see on that commercial when you see go visit San Diego. That's it. That's the Fontaine MD patients right there.
So are your patients, are they getting younger and younger that are coming in for hormone replacement therapy, older and older, or a mixture of both?
Well, a mixture of both, really. I mean, ideally, once you start the hormones, you want to continue it as long as you want to continue to thrive. As long as you want to continue to feel well, be active, look good, you want to continue with the program. So we see patients all the way into their 70s, 80s. I have a 73-year-old patient. I believe he's 73 years old. He's retired as a mechanic, and he's kind of those active guys, can't really sit still. So then he goes and gets his contractor's license, and in his late 60s, he starts a contractor's business. But he was having a problem he was feeling a little fatigued and napping all the time and tired, just having a little hard time keeping up, because he wasn't quite as young as some of the other people doing what he's doing. We put him on thyroid, testosterone, worked on his diet a little bit. He pretty much stopped the napping, and now he's focused on, all right, I've got this driving on injury. Now he's working on his weight. He's working on his diet. He's like, all right, well, we got that one done. I want you to help me with my diabetes and my cardiovascular disease, and we're going to just kind of chip away at those and really sort of help him from aging at the age, in that 70s, 60s, 70s, 80s, that's the time we have accelerated aging. I don't want that for my patients. For my patients, we like to think, here's the healthy part of life, and then all of a sudden, close to the end,
you live great until you're like 90 years old.
Whatever age it is, but you drop out. Versus the average American, they're like this, and then their disease state is prolonged. And first they're on their diabetes pill, then they're on their heart pill, and it goes on and on and on. And they slowly die over 30 years. That's not the kind of lifestyle and practice that we're promoting. We're promoting, staying vigorous and healthy as long as you can.
So like you said, the second half of life should be the best half of life.
It should be. You can continue to feel good, but you got the wisdom of, you're not going to be making those stupid youngster mistakes. You got the wisdom, so you can feel good, look good, move good, and you got the head on your shoulders. You got the experience. You got life's experience.
So your practice is in Carmel Valley. They start with an evaluation, right?
Yes.
And then from there, you choose the blood work, and then you get them started on hormones if they're candidates.
That's right. And then. But that's just the beginning. I mean, we develop a relationship. I get to know my patients, and then we follow them closely. We take care of all of their hormone wellness-related activities they come in as much as they need to see me for any symptoms, complaints related to the hormones, because it takes a little bit of time. We want to adjust them. This is fine-tuning. This is definitely the art of medicine. This is not cookie-cutter medicine. There's no just, you do one thing and it works for everybody. We adjust everything on an individual basis.
Okay, good. I want to thank you for coming on. Interesting stuff.
Thank you very much, Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.